Hello everybody, this is Dr. Langdon again with a video about KP or Keratosis Pilaris, also called hyperkeratosis pilaris. And you've probably had this or heard of it. It's that little buildup of slightly raised tiny little bumps on the back of your upper arms. And it's just the buildup of this keratin molecule at the base of the hair follicles. Some people call it chicken skin, not to be confused with goosebumps, which is more of when the little muscles pick up the hair and make it stand on end from feeling cold or scared or tickled. So this is different. This is there all the time. You can sort of pick at those little bumps at the base of the hair follicle. And I just wanted to let you know that it's harmless. It's not contagious. It can sort of come and go as far as severity. And a few tips for treatment. It is not mandatory that it be treated. This is not the sort of thing it's really worth making a doctor's appointment for or going to the dermatologist for. Typically, most cases are not that severe. But if you do want to treat it because it's just bothering you, you certainly can. So I wanted to tell you how quickly. It's pretty easy. You can keep that area exfoliated by picking or preferably just doing some exfoliation with a little shower scrubby. And then afterwards, when you get out of the shower, you can apply an emollient. In fact, you can use the emollient several times a day if you can remember to do it. The greasier, the better. My favorite probably is Aquaphor, but there are multiple products over the counter that are good and greasy, and that's good. And then the other thing you can use for actual treatment is any form of a keratolytic. So there are alpha hydroxy acids like glycolic acid, lactic acid, that sort of thing. There are There are beta hydroxy, which are things like salicylic acid. All these are available over the counter. You just have to look for the active ingredient on the side of the cream bottle. And there are also products with urea in them that can help break down that keratin at the base of the hair shaft, at the hair follicle, on the surface of the skin. So don't be alarmed. We do see this rash sort of starting usually in childhood or adolescence, and it can typically get better with age, but not in everybody does it improve with age. Occasionally, as a backup, we'll even use retinoids, like topical, like as we would use for acne. Sometimes we'll use that if it doesn't respond to emollients and keratolytics. Hope that was helpful. Thanks.